This presentation is made possible by the Association of Professors of Gynecology and Obstetrics Medical Education Endowment Grant. The content is solely for educational purposes and does not necessarily represent the views of the Association of Professors of Gynecology and Obstetrics Incorporated or Western Michigan University. Homer Stryker, MD, School of Medicine. Case 5. In this scenario, 2 young women come into the Ob-Gyn clinic for preconceptual counseling.
Doctor, your patient in room 3 is ready. She would like to have a baby, so she wants to talk to you about some questions.
Okay. Is she here with the potential father?
She's alone. Oh, well, she's not really alone. She's got a friend with her.
Okay.
Well, I don't see anybody else there with her.
Okay, great. Thank you.
Thanks.
You can come in.
Hello. Hi, I'm Dr. Jones. How are you doing?
Nice to meet you. I'm good. How are you?
I'm pretty good. And what's your name?
Isabel.
Okay, just want to make sure I have the right person. And I understand that you're coming in today to talk about getting pregnant.
Yeah, we want to have a baby, but we just want to look at our options and see what it takes to have a baby. I don't really know much about pregnancy, so I kind of wanted to talk about anything that we will need to know, anything to do with tests that we have to take. That's pretty much it.
Okay. All right. And was your significant other unable to make it today?
This is my significant other, Amber.
Oh, I apologize. I didn't even realize. I usually introduce myself to everybody in the room. I'm sorry. So the 2 of you want to get pregnant?
Yes, this is my girlfriend. We've been together for 2 years, and we want to have a baby, and we're just trying to figure out our options right now. We want to know, will we have to see a fertility specialist? And I have Medicaid, and I want to know, would that cover it?
Okay. I'm not able to answer that question, but usually when we're dealing with a scenario like this, we would get you referred over to an infertility specialist, and they will be able to talk about different options, and they would talk about costs, and you can kind of go from there.
Okay.
Now, who is wanting to become pregnant?
I do. That's why I made the appointment. We're looking into different options about having a sperm donor that we know versus a sperm donor that we don't know. And we just want to look into different options of how to get me pregnant, like, in vitro fertilization. And yeah, that's pretty much it.
Okay. Well, let me step out for just a second and get that information from my medical assistant. And again, we have a handout that has doctors' offices and the actual doctors in the area that you can go and talk with. Yeah. All right, I'm back, and I was able to get that information from my medical assistant. So here is this information, again, with the doctor's offices and names of people in the area who may be able to help you.
Thank you. Thanks. Isn't there any other information you can give us here? Because we don't know if we're going to need a fertilization clinic because we're not sure on the way we want to decide on getting pregnant.
Right. Well, unfortunately, here at this office, when it comes to these types of fertility treatments, we don't have the ability to help with that. And that's why we got to get you over to an infertility specialist, and they can give you more information there.
Okay. Thank you so much. Thanks.
Nice to meet you.
You too. Nice to meet you too.